Hi all, hope each and everyone is doing well and good. And it is me, Dr. Amrita here. So today I'm going to discuss about pathology, the most important topic that you should definitely study. Because without studying this, you cannot go to the exam hall because this is going to be very important. We know that there are few more days left and you want to use those days very productive because these days hard work is finally going to determine the destination as well as the dream branch. So this video I'm dedicating for all my juniors, and I am going to say everything so quickly because I don't want to waste your time as well as I don't want to increase my storage space also. So I want to just wind up this video within 6 minutes. Okay, so if you're planning to start pathology for a Neet PG, if the Neet PG is your goal, I will say that for pathology, hematology is going to be very important. So begin from hematology. The blood chapter is very important. All those leukemias, AML, CML, which one have got its convent appearance, and all those things, all rods where it is seen in and out, including the picture, how to identify. Just study very well AML, CML, all those things, very important. Okay, so hematology should be the key. And how to find out, they will be giving a clinical scenario, and they will be asking you to find which one is this leukemia, whether it is acute or it is chronic. And also you will be knowing that, like N11 which one is, 811 which one is, that sequence that you should definitely learn. Because when you analyze the previous year questions and 2021 also, they have asked a question that's a clinical scenario they'll be giving, and they will give just the diagram, or sometimes you will understand this is a type of leukemia, and they'll be giving you like this chords, like this is what happened 1122, like that 922, they'll be asking you all to find out. So if you understand whether is it an Ewing's or whether it is an acute or CML, only they will be Burkitt's lymphoma, then only you will be able to pick it up. So Burkitt's lymphoma, there's a typical feature, there's a child who have got jaw, and there'll be the picture and everything. So in and out, first you want to study hematology well and good. Please don't leave anything from hematology. Second thing I want to say that you want to study that ESR wala thing, that they'll be giving a color code, like for violet color, that bottle gap, what is that being, is it for EDTA? What is that for blood? That blue thing, voila, is it sodium citrate? And what that there is a box is there in your table. I hope you got it what I am explaining. Please study it in and out. Where is this heparin stored? And all those things, please study in and out. That is going to be very important. So finishing this hematology and all these voila things, then you want to move towards neoplasm. Neoplasm, there is a separate, like this they have asked, like in metaplasia what all changes, just all important question. Do that with MCQs. Don't want to go deep, just study with MCQs, you can finish that neoplasia. Then you want to study about this mitochondrial, that all those things, genetics, you want to go with genetics. In that, mitochondrial inheritance is going to be very important. That is, they'll be asking like X-linked recessive, maybe the autosomal dominant is there. So there is a cord which all have these conditions where there is autosomal disease, always glucocerebrosidase, Gotchers, and all those things they will integrate with biochemistry. So biochemistry also you will be learning like this, but that topic you got it now. That is, you have that is X-linked recessive, where you see which all disorders you will be seeing. Very important, study that at the same time. And also you want to learn, if they give a pedigree chart and they might be give a clinical scenario that may be an autosomal disease, maybe, and you want to find out in the pedigree how to identify whether it is autosomal dominant, X-linked recessive. That's why it's going to be very important. So after finishing this, you want to go towards thyroid wala, because thyroid is all time the favorite, that all eye where do you see, or this papillary cell carcinoma, what all things you will be see. So in pathology, what is very important is you want to learn the histology, how to identify. There are certain coffee beans where it is being seen, so they will be giving pictures, so you will be able to understand this is coffee bean where it is seen. If it is papillary, where this is the all eyes. So that type of pictures, just do with the MCQ. So MCQ doing is very important for pathology. For all those things, do like that. Thyroid is very, very important. Then I want to say that the pocket area for the examination, all time the favorite area is going to be the kidney wala. So kidney you want to identify. So where is that mesangial thing, Alport syndrome, membranous, what is happening, postglomerular, all those things you want to identify the picture, as well as there's a box that minimal change, this is what is happening. Just study in and out, because this is going to be a favorite question. As well as just study this that renal calculi, like ammonium, that urate crystals, where you will see what happens in laxative abuse. Those questions, that coffee bean, crystalline color, what is true white stones, that's all very important. Then come to respiratory. Respiratory, that asbestosis, that was all time favorite. And amyloidosis, that's in renal, is also very, very important. GIT wala, that's hepatitis, acute hemochromatosis, that's all thing I'm saying that just do with the MCQs. Just see the picture to identify all those things. Please move very fast and quick.